Hi everyone, my name is Brandy Montgomery. I'm a student at the W. Today I will be teaching you all about antibiotics. I am teaching a church group today. This is Patsy Wilson, Alice Montgomery, Alicia Ware, Valerie Douglas, and Marquess Neighbors is the cameraman. They all have kids, and I'm sure they've all had kids that have taken antibiotics, and I'm sure they've taken antibiotics. So today I'm just going to teach them a little bit about antibiotics and how to use them properly. What are antibiotics? Antibiotics, also known as antimicrobial drugs, are drugs that fight infections caused by bacteria in both humans and animals. So today I'm going to teach y'all about antibiotic resistance. This is when you take antibiotics and you do not follow the instructions properly and you do not complete your antibiotics. Very important to complete them. So antibiotic resistance is a growing problem both in the United States and across the world. The main driving factors behind antibiotic resistance are the overuse and misuse of antibiotics. Antibiotic resistance is the ability of bacteria to resist the effects of an antibiotic. Antibiotic resistance also occurs when bacteria changes in a way that reduces the effectiveness of drugs, chemicals, or other agents designed to cure or prevent infections. The bacteria survive and they continue to multiply, causing more harm. So it's important to take all of them. Why should you care about antibiotic resistance? This is very important. Antibiotic resistance has been called one of the world's most pressing public health problems. It can cause illnesses that were once easily treated with antibiotics to become dangerous infections, prolonging suffering for children and adults. This means if you get an antibiotic for an infection and you do not take it all, let's say you get that same infection again, it's going to be harder for that antibiotic to work the second time around because you didn't complete your first round of antibiotics. So that's why it's important to complete all of them. Antibiotic resistance, resistant bacteria can spread to family members, schoolmates, and co-workers and may threaten your community. Okay, this is just a picture showing how antibiotic resistance happens. So the first one, it says, number one is lots of germs, a few are drug resistant. Number two, antibiotics kill bacteria causing the illness, as well as good bacteria protecting the body from infection. So when you take an antibiotic, it's going to kill the bad bacteria as well as the good. Number three, the drug-resistant bacteria are now allowed to grow and take over. Number four, some bacteria give their drug resistance to other bacteria, causing more problems. These are the do's. Do ask your healthcare professional about what you can do to stop or slow down antibiotic resistance. Do ask your healthcare professional if there are steps you can take to feel better or get relief from symptoms without using antibiotics. Everything does not cause for an antibiotic. So if you go to the doctor, it's best to tell them exactly what's going on with you. You may not need an antibiotic. If you take an antibiotic and you do not need it, that also can cause antibiotic resistance. Another do is take the prescribed antibiotic exactly as your healthcare professional tells you to. The instructions will be on the bottle. So if it says take 2 a day for 7 days, take 2 a day for 7 days. It's best to take it at the same time every day. Safely discard your leftover medications. Do not share your medications with anyone. Ask your healthcare professional about vaccines recommended for you and your family. This will also help you from getting infections. The don'ts. Never take an antibiotic for a viral infection like a cold or the flu. Antibiotics do not cure viral infections such as colds, flu, most sore throats, most coughs and bronchitis, which is chest colds, many sinus infections, and many ear infections. Those do not cause for you to have antibiotics. They have to run their course. These are more don'ts. Never pressure your healthcare professional to prescribe you an antibiotic. A lot of people like to go to the doctor and they like to tell the doctor that they need an antibiotic and you may not need one. Never skip doses or stop taking an antibiotic early if you no longer feel sick unless your healthcare professional tells you to do so. So just because you start to feel better doesn't mean that you need to stop your antibiotics. Go ahead and complete every one of them. Never save antibiotics for the next time you become sick, and do not take antibiotics prescribed from someone else. Antibiotics can cause more harm than good. Taking antibiotics when you have a virus may do more harm than good. As I said before, viruses they don't need antibiotics. Viral infections have to run its course, so you will not need antibiotics for those. This is a picture. It says antibiotics are responsible for almost 1 out of every 5 emergency department visits for adverse drug events. Antibiotics are the most common cause of emergency department visits for these events in children under 18 years of age. These are more don'ts. This is what you do not want to do. Taking antibiotics increases your risk of getting antibiotic-resistant infection later. Antibiotics kill the healthy bacteria in the gut, allowing more harmful bacteria such as C. diff to grow in its place. C. diff is when you've taken multiple antibiotics and you get an infection in your digestive tract, and it causes really bad diarrhea. You do not want C. diff. Most C. diff infections occur in the hospital, but they can occur outside the hospital. These are some facts for y'all. Antibiotic resistance is one of the world's most pressing public health problems. Every time a person takes antibiotics, sensitive bacteria are killed, but resistant ones may be left to grow and multiply. Overuse of antibiotics is a major modifiable cause of increases in drug-resistant bacteria. Overuse and misuse of antibiotics threatens the usefulness of these important drugs. Decreasing inappropriate antibiotic use is a key strategy to control antibiotic resistance. These are some more facts. Antibiotic resistance in children and older adults are a particular concern because these age groups have the highest rates of antibiotic use. Just think about it. Most of your kids, they get sick because their immune system's not built up, so they'll be the ones taking more antibiotics. And then the elderly, they get sick as well because their immune system is not as strong as it used to be. And those are the ones that are taking antibiotics as well. Antibiotic resistance can cause significant suffering for people who have common infections that once were easily treatable with antibiotics. When antibiotics do not work, infections often last longer. They cause more severe illness. They require more doctor visits and longer hospital stays, and involve more expensive and toxic medications. Some resistant infections can even cause death. So, for those of you that trying to save money, don't want to go to the hospital and make more doctor bills, when you get sick and they prescribe an antibiotic to you, it's best to take them as prescribed. That will keep you from going back to the hospital for the same infection. If you have to go back for it, it could be worse the next time around and cause you to have an in-state hospital. In-state hospital visit. You don't want that. That's more money. Okay, did you know at least 30% of antibiotic courses prescribed in the outpatient setting are unnecessary, meaning that no antibiotic is needed at all. Most of this unnecessary use is for acute respiratory conditions such as colds, bronchitis, sore throats caused by viruses, and even some sinus and ear infections. Total inappropriate antibiotic use, which includes unnecessary antibiotic use plus inappropriate antibiotic selection, dosing, and duration, may approach 50% of all outpatient antibiotic use. The number of antibiotic prescriptions written for children has decreased in recent years, but almost 30% of antibiotics prescribed to children are still unnecessary. So when y'all take your kids to the doctor, just make sure you talk it over with them. Make sure that your kid needs an antibiotic. They may not need one. Antibiotics cause 1 out of every 5 emergency department visits. Antibiotics are the most frequent cause of AEs, leading to emergency department visits in children, and 7 of the top 10 drugs involved in these, leading to emergency room visits, are antibiotics. We spent $10.7 billion on antibiotics in the United States in 2009, including $6.5 billion among patients who visit the physician offices and $3.5 billion among the hospitalized patients. All right, so let's make a difference in our community and let's stop the antibiotic resistance. Is there any questions? Any questions?
Do all antibiotics have to be taken with food?
No, ma'am. The instructions will be on the bottom.
Okay.
Well, if the antibiotic kill the good bacteria and the bad bacteria, how do you get the good bacteria back?
You can take a probiotic.
Very good question.
Fallon, have any questions? Alice? Marquez, any questions? No? Okay, well this will wrap up my presentation to my church group. Thank you.
Thank you.
Very informative.
Informant.